friends, welcome to another episode on Health Buddy. Today's topic of discussion is how to go about when your doctor writes you a fasting blood sugar test. Fasting blood sugar test is a very common investigation that your doctor may write in order to diagnose you and detect if you have diabetes or check your sugar levels in general. Now, I'm not gonna give you the textbook definition of what fasting blood sugar level is because that is already available in your Google search, and I don't want to give you some medical jargon that you won't be able to comprehend. My task over here is to make medical science as easy as possible so that patients can comprehend it and apply it in their daily lives, because when they understand it, then only they can apply it, right? So just in order to simplify things, I'll tell you what fasting blood sugar level does. In that, since you haven't taken a meal for a period of time, the sugar levels in your blood falls. And in case of people who are pre-diabetic or who are in the range of diabetes, who have blood sugar levels in the range of diabetes, their blood sugar level, although it falls, but that fall is really minimal. It doesn't go really down as compared to a normal healthy adult man. So now, how do you go about this test? Like, what preparation you need to do as a patient in order to get this investigation done accurately. So first of all, let's break down the term fasting blood sugar. So of course you need to do a bit of fasting, right? So any guesses for how many hours you need to fast? Let me know in the comment section below. Well, I'm now gonna give you the answer. It's 8 hours. 8 hours of fasting is required for you to get the fasting blood sugar level test done accurately. Now, what I mean by fasting is intake of non-calorigenic diet for 8 hours. You can only drink water. You cannot even drink tea, black coffee, with or without sugar, doesn't matter. I've seen some patients turning up for this test with tea, having tea in the morning, and they say that, okay, I have just taken tea without even having any sugar, or I haven't taken breakfast, I just had one fruit. Things like that are not to be done. When you come for this test, you have to be on an empty stomach for 8 hours. Of course, you can drink what you did during this period, but nothing else. Okay. If you do it less than 8 hours, the glucose value that comes will be false. It's gonna give you a false positive result. One of the patients that I came across was really sad because he was like really following a good diet, healthy diet and stuff like that, and when he got this fasting blood sugar level done, it came out in the diabetic range, and so he was really sad that in spite of following all the regulations and health tips and stuff like that, and being on a regular diet, his blood sugar level was still so high that he was in the diabetic category. And when a doctor labels someone as diabetic, it's a lifelong label that you have to carry with yourselves. So yeah, this test is pretty serious, right? And so when I inquired about like why this blood sugar level was coming so high, and then it came into my attention that this patient had been to a party last night, and he consumed his food really late, and because of which duration of 8 hours wasn't fulfilled, and therefore it was just like 4 hours or so, and he got his test done. Therefore the blood sugar levels in his blood were really high, and therefore the technician or the doctor categorized him into the diabetic category. So it's very necessary in order to that you get this done, test done in a proper way in order to get the accurate levels. One more precaution that you need to take while getting this is done is that mostly the lab technician is gonna take the blood from your forearm, and so you need to make sure that this area is really cleaned and sterilized. And of course the technician usually applies a spirit in order to clean this area before he takes your blood. So make sure that this area dries when he usually sometimes these technicians are in a bit of hurry because they have a long queue of patients from whom they need to take blood, so they hurry it a bit. You need to ask the technician politely that please wait for a second in order for the spirit to dry, because the efficiency of the spirit to kill the organisms present here occurs when the spirit dries. Then only it is effective. All right, and make sure you don't have any skin infections prior to getting your test done, because when you puncture your vessel in order to get the blood, if you have any superficial infections on the skin, those bacteria or those organisms can directly enter into your bloodstream, causing bacteremia and other more complex diseases, right? So yeah, these were some 2 tips like which you can apply in your daily life to improve your outcomes. Thank you for watching. See you in the next video with more health tips. Bye, take care.
Thanks for watching. Don't forget to like, share and subscribe. Press the bell icon so you'll be notified every time I'm on YouTube. Bye.